Hello friends, today I want to show you the newest technique in the treatment of benign prostatic hyperplasia. This is the Rezum treatment. This is the special device. We apply this procedure with this device and there's a needle going inside the prostate and it gives hot boiled steam inside the prostate and it shrinks the prostatic tissues very easily. So first of all, let's see, this is the here, the steam goes in three directions, and it is really very effective because when the vapor turns to water, it gives out a very significant energy, and this energy is effective in the prostatic tissue and it shrinks the prostate. This is the first important part of the procedure, giving this steam. And we have this device for this aim. And the second important thing, this device is very thin. Look at this. It's very thin, tiny instrument. And it can go throughout the urethra very easily. In older operations, in prostate, TURP or HOLEP, the instruments we use are in this thickness, like this. So usually the urethra is not enough wide and we dilate the urethra or cut the urethra for the instrument to pass easily. So this is important step. So what we do inside the operation, let me show you this. Okay, this is our instrument. It has a special tip here. This tip enables the needle to turn 90 degrees and penetrate into the prostate. And the needle is 1 centimeter, so it does not penetrate too much. It is because it is in non-invasive and just gives the steam 1 centimeter deepness. The most important property, one of the features of the steam is it can disseminate all over the prostate, inside the prostate diffusely. So this is a special patient. In this patient, we also have prostatic inflammation. We can see some calcifications here. And now one of my fingers inside the rectum, and I am doing some prostate massage to empty the prostatic inflammation. If this patient was younger and has no obstructive symptoms, no difficulty in making urinating, we will only treat this patient with prostate massages, with emptying these inflammations. But he also had some voiding difficulties, so we choose to treat the prostate too. You see the cloudy fluid, floating particles inside the bladder. These are all infections. So still I am doing some massage to right lobe of the prostate and there is infection coming out. We don't want our steam to go inside the inflammatory fluids because inside the prostate there are too much fluid, the effectiveness of the steam will decrease because it needs tissues to penetrate to shrink the tissues. It can't shrink the infection, it can have no effect on the fluids. So we empty the prostate in this way if we think the patient has infection, inflammation, prostatic chronic prostatitis likes symptoms. So after that, we will measure the distance. Still, I'm doing some massages to be sure that we empty the prostatic inflammation as much as possible. So this is a 12 minutes video, and for now we are in the fourth minute. So we didn't do anything yet, just trying to empty the inflammation inside the prostate. So if we come here, then we investigate the bladder for if there's any bladder tumor, if any bladder diverticulum. We look to ureteric orifices. We search for these structures. Then we calculate the distance between the bladder neck and the verum montanum. So the length of prostatic urethra is important. We calculate this distance. That means if this is 2 centimeters, we will apply 2 needles to each prostatic lobes. If this 3 centimeters, we will apply 3 needles. And so the most important part of this operation is calculating and then choosing the right place to insert the needle. We have some triggers here. We target some place, we give some fluid, and then when we push this trigger, pull this trigger, the needle goes in. And then we pull the blue trigger and it gives steam for 9 seconds. This is very easy. The urethral mucosa is not affected. and it does not need too much urologic experience, doctor experience. The other procedures like TURP or plasma kinetic or HOLEP, they really need too much urologic experience, experienced doctors, and then these experienced doctors have to do many cases to understand how the procedure is performed in the best manner. You see the changes in the tissue. There's swelling of the tissues with the steam and a little color change, and from this little needle hole, inflammation is coming out. So we perform two needles in the left lobe. Now we will turn to right lobe. This is bladder neck. We come distal to the bladder neck just not to interfere with the bladder, and we trigger this, and the needle goes in, and you see some swelling in the tissues. So it does not need experience. It's very short. In 5 minutes, we can treat the prostate. So the patients who are having trouble in taking anesthesia will easily be treated. Look, inflammation is still going out. When the steam goes in, it goes out. The inflammation goes out. So anesthesia is not a problem. It's very short. It can be done to any patients. Here I push the needle. Look, the infection. Oops, one inflammatory big particle go out. When the steam go in, inflammatory particles go out. So it's effective for obstructive bleeders. Still, for chronic prostatitis, it can be used if there is no cure for chronic prostatitis. So it's a thin device, no chance of giving some damage to urethra, and we don't interfere with the prostatic urethral mucosa. This makes one of the advantages of this procedure, because in normal procedures, when we have to resect this mucosa, it's a very special tissue. When we resect it, the urethra loses its capacity and it becomes sticky. It will stick to each other, so we have to open it very widely to perform a successful operation, because with the urethral mucosa, untouched urethral mucosa, there is no sticking to each other. But when we resect this mucosa, we have to open it very widely, and it becomes very difficult. Needs experience for the older procedures, and it has the capacity to interfere with the nerves. The complications come because we have to open it very widely. It takes too much time. But in this procedure, you don't touch the urethral mucosa, so just a little shrinkage in the tissues will be enough for this patient to make urine, to void as the old days, to void better compared to his situation right now. So this is our procedure, Rezum procedure, easily performed, needs no experience, needs no urethral dilatation, gives no harm to urethra, gives no harm to urethral mucosa. It doesn't disturb the Teflon property of urethral mucosa, and the steam energy, the steam heat shrinks the prostate easily. So it's the newest technique. I just wanted to show you how we perform it. We will continue such videos. Thank you.